Thanks. Thanks a lot. I'm Dave Thomas. Linda will follow me. We won't stand side by side. That would look a little silly, I think. But a real pleasure to be here today. I think you guys are talking about doing exactly what we want to see happen in a lot of different ways. And to support you in that is a pleasure to do. Just a little history of me. Sorry, people like talking about themselves, so I'll mention myself. I've been at NIDA 20 years. Before that, I worked on a NIDA grant where I was surprised to learn that NIDA does pain research, but we do. We're one of the largest supporters of pain research at the NIH. And before that, I was at the Dental Institute doing pain and opioid research. So I've been very involved with this for a long time. It's certainly it become extremely relevant right now, this topic of opioids and pain. We've been working, we're kind of partners in crime on a lot of different things, but we've worked on the National Pain Strategy together. I was involved with the CDC guideline development as a federal partner. And when those two things were released, note, they were released at the exact same time or the same week, and that was on purpose because the CDC, we knew down there when they were creating them that that was taking something away, but there was a void. It needed to be replaced with something, and that was integrative, comprehensive pain treatment. So we're working, especially her, but we're working together trying to implement the National Pain Strategy and put the other part in place where you get the comprehensive pain treatment, as opposed to relying on opioids so much. Another project that we've done through the NIH Pain Consortium is the Centers of Excellence in Pain Education. Clinicians, medical doctors get almost no training in pain in medical school. It's about 9 hours over the course of 4 years. And for such a big problem with so many issues, to get 9 hours is awful. So we're trying to encourage more treatment, nip that problem in the bud, more education about pain treatment throughout medical school, nursing, pharmacy, dental schools. And a last thing that I want to mention that we worked on through the Pain Consortium is the Pathways to Prevention Opioid Conference. 4-year-long process trying to get some answers about the efficacy of opioids for chronic pain. Back in the 2000s, you probably have been to these meetings. You go to a pain conference, and there's the opiate good people, and they'll be saying how good they are, and the opiate bad people saying how bad they are, and you put them together, and they argue about opioids, and it wasn't really getting us anywhere. This conference used this elaborate process to get as unbiased look at the research as possible. And the soundbite from it is basically that there is no evidence that opioids work long-term for chronic pain, but there is substantial evidence that they can cause harm. So that's been taken in a lot of different contexts and been used in a lot of different ways. I would like to mention I have a conflict of interest, no regular conflict of interest, but I care about prescription drug abuse, but I also care about people in pain. I think we have to fight both epidemics together, and it's not unreasonable to fight them both together because I see them as stemming from the same cause, that we don't take care of people in pain well, and that we used opioids as a substitute for comprehensive pain treatment, and we're in the mess we're in. Let me just talk about the mess. It was Mark, you mentioned some of the stats, but 33,000 people died in 2019 from opioid overdoses. That's a big number. Put that in historical context, and I do think we're living in a historical time in this context. That's the biggest drug abuse epidemic in our country's history that I know of. There might have been one that slipped under the radar. And in terms of just epidemics, it's the biggest epidemic in 100 years. So this is really a moment, historical moment. But then you talk about the people in pain. IOM 2011 came out with 100,000 people with persistent pain. That's probably about true. And what's disturbing about it is it doubled since 1999. Very similar analysis was done in 1999, and there were 50 million people in chronic pain. So it's not only drug abuse, a prescription, an opiate epidemic, but there's a pain epidemic, and it's growing rapidly. In terms of the cost of pain in America, certainly the human suffering is bad enough, but we spend more on or pain costs our country more in terms of lost wages, productivity, and things like that than we spend on our military. So it's a big number. There's a lot of people in pain. And what we thought was, back in the 90s, by we, not me, I don't, FDI's hopefully not listening to that, but we started to believe that we first, well, let me just explain the scenario. We had clinicians that weren't trained to take care of people in pain very well. We don't reimburse taking care of people in pain very well. It creates a problem. What do you do when you're a clinician? And then opioids got promoted as a cure-all. Just give them this. You know, in the presence of pain, you won't have any problems with prescription opioids. Well, that's one thing led to another, and that was a prescription for disaster. And I see that as how we got to where we are right now. So anyway, the National Pain Strategy, I think, is when it was coming out, people came to me and said, and it gets passed around the government and things, and there was like 80 of us working on it from various angles. I got the argument that why are you doing it this way? It's not anti-opioid enough. And my response was, this is anti-opioid. If you take care of people with pain without an over-reliance on opioids, that's the solution to the prescription drug abuse problem. We have to do these other things like naloxone and all abuse deterrent formulations. There's a lot of angles to fight this problem, but I really think that comprehensive pain treatment is nipping the problem, getting it at its source, cutting the legs off the prescription drug abuse epidemic, if you will. I'm imagining, and this is why we're so intent on promoting the National Pain Strategy and integrative comprehensive pain treatment, but I can imagine a world, and it was, Mark, you mentioned like how the military takes care of people, or maybe it was Jonas, it was you, because we met with the military and you about this, but they do all sorts of things, chiropractic, acupuncture, cognitive behavioral, they do the whole range of treatments for their people in pain, and they'll use opioids, or they won't to a certain degree. Well, I'd like to see that extended to the whole population. What would that do for people in pain, the 100 million or so people in pain? They'd get pretty good treatment. They would go and they would get all sorts of things, and they'd be, and if it was working, they'd get more. If it wasn't working, they would be switched. They might get opioids. If they weren't working, then they'd get taken off. And I think people in pain would really, really benefit from that system. But imagine that same system for people that are just want to use the healthcare system to get drugs. Are you going to do that? Are you going to go and get poked with needles and somebody straightens up your back and then you're doing physical therapy and talking to people about? No, you're just going to go get out of the clinical setting, and that's what we really want to do, is get those people out of the pain setting and not have those waters muddied. But also what might happen is they might be pulled into the clinical setting for the right thing, and that's treatment of their drug abuse problem. So I think really attending to people in pain will not only help stop prescription drug abuse, but it'll help people in pain and get us out of this mess. We get complaints and concerns that doing all this for people in pain would be expensive. Well, we're paying a dear price right now. I mean, by not doing anything, by allowing the status quo to exist, we're paying a huge price in terms of human suffering and in terms of just dollar amounts to our society. It's a tremendous drain on us in many ways. So with that, I think I'll conclude by just saying I'd like to see this group succeed. I want other groups that are promoting other types of proven pain treatments to succeed, and I think together we can raise awareness that it's time to take care of people in pain and not just with opioids. Thank you.